Cancer care in Greater Manchester is going to radically change in the next few years. Hospitals, GPs and patients are joining forces to save more lives, improve treatment and make sure patients have a better quality of life. Patients are at the very heart of this new service, and we really need to listen to patients and see what they think is important in the design of these new services.
My name's Bex. I was diagnosed with Hodgkin's lymphoma in 2004. I was 17 years old at the time. My overall experience of being treated for my cancer was really good actually, but the beginning part, I didn't get diagnosed straight away. It took actually a few years, and by this point I was stage 4 when they caught it. For me, it would have made my whole experience so much easier if I'd been diagnosed at stage 1 or stage 2, because then it would have cut my treatment time in half. If I was going to my GP a number of times and he wasn't picking up on something that I felt was quite serious, then I definitely think that another system put in place for me to go and get a second opinion or seek help somewhere else would have been really good.
My name is Saeed and I was diagnosed with rectal cancer 6 years ago. One of the things that I would like this initiative to look at is the psychological effect that having cancer has on patients. I would have loved to have had a list of 50 patients which have been gone through exactly the same as I have, so I could communicate with them. For me, the solution would be to put patients in touch with patients. They are the same. They can talk to each other like cancer patients, not like doctors and cancer patients.
Hi, my name's Mark. I got colorectal cancer when I was 31. As a patient, I would have liked to have had all the options there and had them discussed. Some of them are quite complicated, but I want them made easy for me, for the patient. I need to be involved in decisions about the rest of my life. And it's not just about saving my life, it was the quality of life after cancer that was important to me. The saying is, no decision about me without me. And if we can get that into our cancer system and our pathway, all the good work that everyone does will be made better, because the most important person, the most important ingredient will be added to the mix, and that's the patient.
My name's Vanessa and I was diagnosed with squamous cell carcinoma. This is a tremendous opportunity for Greater Manchester to move forward not only with early diagnosis and treatment of patients, but also to consider what happens at the other end of the spectrum as regards rehabilitation services. In the future, we will have a greater number of people being treated and recovering from cancer, and they will be dealing with late effects of cancer. And rehabilitation is going to be key, and Manchester has the opportunity to take that forward also.